just found an excellent page, the Monro-Kellie Doctrine, talking about increased intracranial pressures over here, and when we eventually lead to uncal or brain herniation. So this is interesting or important to know. This is Cushing's triad here. So bradycardia, we see. Irregular depressed respiratory rate, we definitely see. We have widened pulse pressure here. Interesting. So more like hypertension, high blood pressure, is kind of what we're going to see. But the reason they have listed here widened pulse pressure is because the systolic pressure is going to be a lot higher than the diastolic pressure. So that high systolic blood pressure with bradycardia, with a suspected brain injury, really catches my attention. And then other signs and symptoms down here is, again, the vomiting. So the typical test question or scenario for an epidural is going to be that patient that gets hit near the temporal region here, where the suture lines of all the different frontal, temporal, zygoma, all these bones come together here. This can lacerate which vessel? Good. Middle meningeal artery. You get an epidural. That's the classic patient who has that, quote, lucid interval, where they become unconscious during the injury and then have a lucid interval where they're kind of back to normal and then become lethargic again. Then this is where that increased intracranial pressure starts to set in. So then when we finally see them, they're bradycardic, they're hypertensive, irregular respirations, depressed GCS, and then vomiting is a sign of increased intracranial pressures. When we adjusted my son's VP shunt it was just a coincidence, but he was having some reflux around that time too. And we adjusted his shunt, and then like a day or two later, he kept vomiting, and I was freaking out. And we actually went and saw our pediatric neurosurgeon and got a fast MRI, they call it, for the little ones, just to make sure everything was okay, which it was. Same issue though with the occluded transverse venous sinus, which everyone knows about. But again, vomiting is a telltale sign of someone that's got increased intracranial pressure. So always keep an eye out for that one and get your book.